The internet. It's big, endless, and ruled by giant tech companies. You ever feel like sometimes your internet provider exists just to make your life as complicated as possible? It's okay to expect more from the internet. The internet can connect you to people, to new ideas, and unlimited opportunities, as long as your internet provider doesn't get in the way. We're Ting, and in 2014, we set out to build internet that puts people first. Fast and reliable, clear and predictable, priced fairly without the fine print. People first, designed to put you in control. For a long time, your internet options were limited. Now they aren't. With the choice between big internet, complicated internet, or your internet, you choose the internet that actually feels like yours. We're Ting, and we're here to help you make the internet your internet.
Rescue Wood Rehab in Fuquay Arena is proud to be your local custom woodworking shop for furniture, home decor, and more. Visit us and maybe spend some time with our shop dog Amber. Rescue Wood Rehab is more than wood, it's an experience. rwrnc.com.
Summer travel is coming. Make sure your car is ready with Carry Car Care. Family owned and operated, they'll keep you safe on the road all season long. Give us a call at 919-380-0040 to schedule your summer service today or visit with us at carrycarcare.com. Carry Car Care. It must be right, or we'll make it right.
Hi there, and welcome to What's Up Wake.
Spend your day is the only way. Take a break with What's Up Wake. Ooh, What's Up Wake.
Presented by the publishers of Carry Magazine, Wake Living, and Main and Broad, What's Up Wake covers the people, places, restaurants, and events, essentially all the cool stuff and great news of Wake County. I'm your host, Melissa Wistahuff. Join me as we find out what's up Wake. Summer is right around the corner, which means longer days, more sunshine, and if we're being honest, maybe a few questionable sunscreen habits. Today's episode is all about keeping your skin happy, healthy, and glowing, preferably without overcomplicating things. I'm joined by Dr. Thomas Knackstedt of Peak Dermatology, who's here to help us separate skincare fact from fiction. We'll talk about how to protect your skin during the summer months, what actually works and what's just hype, and how to age gracefully. So whether you're a skincare minimalist or someone with a 10-step routine, get ready to take some notes and maybe finally start using that sunscreen the way you're supposed to. Thomas, welcome to the show. Thank you so much for being here today. What inspired you to become a dermatologist and not another type of doctor?
Yeah, that's a great question, and thank you for having me. I actually grew up with a dermatologist as a close family friend, and I think I'm unique in that way that I basically went through undergrad, medical school, and residency with the plan of being a dermatologist, inspired by somebody I met in middle school. Shadowing summer after summer is what really gave me that foundation, and then more tangibly, just being able to treat diseases that I can see is really rewarding, right? I can look at my patients and many times within a couple of minutes know what's going on. And that then allows me to spend the rest of that appointment to get to know what they think about their disease, because skin disease can be deeply personal and we all have some strong beliefs of why we're having these skin diseases. And you can explore that more rather than having to do the investigation that an internal medicine doctor or a cardiologist might have to do.
I think that's really interesting that you grew up knowing you wanted to be that specific type of doctor, because the doctors that I feel like I've met in the past knew they wanted to be a doctor but didn't know their specialty maybe until they had gone through at least some of medical school. So you grew up knowing you wanted to do this. And I'm looking at you and I'm thinking, dang, he looks really young, but he could be 85. We don't know because he's a dermatologist.
That's right.
You've got a very good skincare routine. So what would you say is the most common question that you get when people find out what you do for a living?
Yeah, so there's really two. And by the way, I'm 40, so
So you have
in
very
my
good
prime.
skincare. Yes.
But that relates to your question. So the one thing is often what can I do for my skin right now to make it better? And I find that so many times when I talk to both patients as well as in the community, people are actually doing a ton more than I and most dermatologists recommend, right? So in my world, both as a parent and as a physician, I really believe in keeping it simple, which means you've got a cleanser, you've got a moisturizer, and you have a sunscreen. And so anything that goes beyond it, and this is oftentimes driven by social media and some of the consumerism that goes hand in hand with it, nobody needs a 12-step routine
like our
for
teenage
their
girls
skin.
are doing right now.
Yes, and
that is actually one of my questions.
I hope they all forgive me for saying that.
Yeah.
But really, from a data standpoint, less is more. And then the other question I routinely get is, can you look at this spot on my arm? Is this something that
Do
I
you
need to see
just walk in the
someone?
grocery store and somebody's like, hey, doc?
Well, that one is fine, and I'm happy to respond to that. The harder ethical one is when the patient is potentially, or the person in the grocery store is completely ignorant to it, and I see this very obvious melanoma on their temple. You know, what's my ethical obligation to
Do you
either
tell them?
Tell them? I've done it both ways.
Okay.
It's because some people, you know, part of being an independent person is like, you may choose not to want to know. I have this ethical obligation to help and cure, but at the same time, you as an individual also have the right to not know if you have something serious
Or
going
perhaps they know and they just haven't started treatment or something yet too. Yeah.
So I try just to keep my head down in the grocery store.
But I'm sure that that's something that could keep you up at night if you don't say something. So I'm sure you are torn.
Absolutely.
But that's a really interesting point that you made about how dermatologists can literally see what's wrong with their patients, whereas another type of doctor can't spot the breast cancer from a mile away, or can't see what's going on with the person, whereas a patient walks into your office and you're like, yep, this is what this is.
Yeah, and at the same time, we have to be careful because just because it's on the skin doesn't mean that it's superficial, right? Our skin in so many ways is a mirror and a representation of our overall health. For the most part, only about 20% of what your skin looks like in adulthood is defined by your genetics. The remaining 80% is how you're caring for your skin, what your lifestyle is, what your habits are. And so
what you're saying is I cannot blame my mom and grandma for my wrinkles.
Right. No, it's that rock star lifestyle. It's that rock star lifestyle.
Me. Yeah.
But the key is there's the internal overall health of the individual. And then there's also a huge psychological and psychosocial component to skin health, right? There's the suffering that goes hand in hand with having to look in the mirror and seeing either a growth you don't like on your face or having acne that you can't control on your own. And so I never want to dismiss a skin condition simply because it's not life-threatening in the way that a heart attack is, or want to minimize it.
Yeah, because that doesn't mean it's not bothering the person. Yeah. So you mentioned this briefly, but how much do things like diet and sleep and stress affect our overall skin health?
Yeah, they play a huge role. Again, about 20% is probably the genetics that we were given. And the remainder is, to some degree, up to us. Certainly sun exposure is a really big variable in how our skin ages. But there's others that are probably just as important. Sleep is huge, right? There's a reason we talk about beauty sleep. And it shouldn't be misunderstood to mean that if I have 8 hours of sleep last night, my skin will look awesome the next day. But it's a cumulative investment, right? If you go through decades of sleep deprivation, your skin and your facial aging will show that. If you have a diet that might not be the best, your skin will show that. And I think the most important thing is that you can't compensate with the most expensive topicals out there, vitamin C creams, serums, ointments, the poor diet, smoking, and lack of sleep. So I think those
And lack
things
of hydration
really,
too,
absolutely.
right? Yeah, being
Hydration
hydrated.
is key. Minimizing alcohol and tobacco. For the most part, I don't need to know if somebody's a smoker. You can generally tell from their skin.
Okay, so about the skincare products, is there really a big difference in spending a lot of money on creams and potions, or can we go to the drugstore? I've used the same cream for at least a decade, and I just get it at Walgreens or Amazon. Should I be using a much more expensive cream?
Yeah, I think across the board, simplicity is key and consistency is key. And the beauty industry as a whole has come so far. And I think that the main big players who I have no relationship with, but Aveeno, Neutrogena, they make products that are at an accessible price and for many people are just what they need. And so, no, I don't think you need to change it. I think having a good cleanser, Cetaphil non-soap cleanser, Vanity Cream cleanser, having a good moisturizer, which can be something like Olay moisturizer. We're talking 15 to 20, maybe 30 or $40 if you splurge. But I don't think that there's that much of a measurable improvement when you're spending 3 figures on these types of products. That's for just your baseline foundation. Certainly when you start talking about active ingredients, there's a little bit more nuances, but many people will notice remarkable improvement in their skin if they just do the simple cleanser, moisturizer, sunscreen on a regular basis. The consistency with that is far more valuable than having that 1 week a year where you're using a sample that also has a vitamin C serum in it or hyaluronic acid or another active component to it.
So really the consistency plus what you said about the diet and hydration.
Absolutely.
Yeah. And
Absolutely.
the sun, being out in the sun. Okay. I personally have chosen not to go the Botox or filler route. I do reserve the right to change my mind at any time. So I'm going to say that little blurb out there. But let's say I do change my mind. I'm 47 right now, and I have not done any of those things. Is it too late to start doing those things? Or am I'm just going to age like fine wine?
This is putting me in the hot seat. So
don't look at me as you answer.
Right.
You're like, well,
She
there's a
doesn't need
deep
anything.
wrinkle.
Yeah. No, so
I have named all of my wrinkles, by the way,
Right.
after my children and my husband.
Oh,
They
I get
each
that.
have the deeper ones. Yeah, I blame them.
I think when you start going down the road of saying, okay, what can I, in partnership with a provider, do to improve my skin? One of the things that's really important is to have sort of very concrete ideas of what it is you're looking for, right? Because none of us have a magic wand to erase the last 40 years, nor would we want to erase them. But having that conversation and understanding that what we use Botox for and what we use fillers for and what we may use lasers or other devices for are really completely different. I'm married to a plastic surgeon. She's been getting Botox since she learned how to walk. I think I can say that here. I have other people, including myself. I tried it once to know what it's like. And so the main thing with Botox is that it's a treatment that targets fine lines that are created by active muscle movement and contraction. So when you...
So like the crow's feet.
The
smile
lines between
lines.
your forehead glabella and on the forehead.
We call those the WTF lines.
Yep.
Mine is extra deep.
Exactly. And so those are lines that are formed, at least initially, just by the contraction of muscle.
Gotcha.
And so those are the type of lines that are very well targeted by medications that we consider wrinkle relaxers. Botox is one of them. There's many others like it. And fortunately, as a profession, we've largely moved away from sort of entirely paralyzing faces, right? We want our children and our spouses to know when we're smiling with our eyes or when we're a little bit peeved that they didn't unload the dishwasher.
Yeah.
And so Botox has a role there very much. And what I've always told patients is the beauty and the curse of it is that it lasts 3 to 4 months. So if you love it, the downside is you have to come back. If you hate it, well, it was 3 months, but at least now you know.
And it
what your
fully
face looks
dissolves
like.
or goes away or whatever.
So
Okay.
it's really just a temporary blocking within the place where the muscle meets the nerve,
Mm-hmm.
and it allows that muscle to not contract because the signal is not passed on from the nerve. And so that's a very temporary thing.
One of the reasons that I did not go the Botox route, and maybe you're going to think I'm crazy, but I read a Cosmopolitan article probably 15, 20 years ago, and it was about this lady that got Botox and she couldn't open one eye for a year. And I was like, that would happen to me. And I have no doubt about that. So that's why I'm not going to do it. I mean, I also want to see how I age, and I want to also show my daughter that things like that should not be important. However, I'm scared that I wouldn't open my eye for a year, doctor.
Yeah,
What
I
say
think
you?
the first thing I would say when you talk about these sort of treatments, it's important to do them for the right reasons.
Mm-hmm.
And you're not, or at least I think you shouldn't be doing them for any other person or to fit some sort of societal or otherwise expectation of what we should look like as we age and mature. So I think it's because you're inherently going to always be disappointed chasing somebody else's ideals or norms. And then I do think that things like Botox are very much an entry, right? These are reversible temporary things compared to something like a filler injection where we're injecting a medication to restore volume. Those are much more permanent. So those are changes that may be there for a year or more. Now, to go to the Cosmopolitan article, I don't know the details. If Botox is injected into the wrong muscles, the muscles that help us keep our eyes open and elevate our eyebrows, then yes, that can cause drooping of that eyelid or eyebrow, which is mostly just embarrassing and annoying. It generally doesn't last a year simply because we just talked about the mechanism of action of Botox
just a few
is such.
months.
That's just a few months. And so I'm always very careful when there's individual cases of, hey, I heard this and somebody had this and then this happened. Botox and many of the cosmetic products that at least we use in my practice are those that have like decades of track records, right? Botox has been out for such a long time. Most of the fillers have been out for 15 plus years at this point. And so we just have this sort of safety record that makes me very comfortable. At the same time, I think you and I are similar in that I'm not the one to jump onto the bandwagon for the brand new XYZ injection, cream, you name it, because I very much consider there to be this burden of proof on the manufacturer, on the producer to show me this is better than what I'm currently
Better
doing.
works and is safe.
Exactly.
So you're really having to be very careful and mindful about what you
I don't
offer
believe
your
in
patients.
chasing the latest trends.
So as far as Botox and fillers, are there other options that you give someone like me that would come in and say, hey, I really want to age gracefully, naturally, but can you give me a little something?
Right.
So what would you offer that maybe is different than Botox or fillers?
Yeah, so a number of things happen as we mature, right? I think of it largely in terms of volume and then texture. So texture refers to the fact that as we mature, we start to have less consistent skin coloration. We have more red blotchiness, some brown spots, maybe some scaly spots. And that's the texture aspect of aging. The volume aspect of aging is that we start to lose our collagen and elastic fibers. And so the muscle contractions cause more fine lines and wrinkles around our lips, around our eyes, and our forehead. And then on a deeper level, we start to lose some of our fat and bone structure, right? We start to lose the nice fat pads that my 3 and 5-year-old daughters have on their cheeks. We start to resorb some of the bone in that area. And this is where I think it's crucial to say, well, I hear that you want to do something about the way that you see your skin, how your skin is changing as you age. But let's get more specific, because I think it's only when you get specific and identify certain things that we actually can sort of have satisfied patients.
Mm-hmm.
And so everything that's related to building collagen and restoring volume can to some degree be done by injecting fillers, which means you're putting something external back into the body.
What is a filler, by the way?
Yeah, so fillers, there's different kinds, but most of them are some sort of hyaluronic acid product. And what hyaluronic acid as a molecule does is it's a humectant, which means it's a molecule that draws water towards it. So when put in a cream, it's a fairly temporary effect. When injected into the skin, it's a more long-term that you essentially have beads or rods of hyaluronic acid placed in the skin as a gel that then start to bring water in and build some collagen as well.
And it's literally filling in like the
right.
wrinkles, or for example.
And that's mostly used for deeper restoration.
Mm-hmm.
We've gotten away from trying to fill individual lines with fillers because it looks unnatural.
Oh, okay.
But when you start to think about lines, let's say the lines of our nasolabial folds or our jowl area, a lot of that is happening because we're losing volume in the middle of our cheeks. And so if we build volume here, it will redrape or resuspend some of this looser skin lower on the face. The alternative to that is really some sort of treatment that stimulates the body's own collagen. I think of those treatments as things that conceptually sort of injure the skin, which means whether you're using a microneedling device with sort of 10 to 20 sharp needles, or the energy of a laser beam or ultrasound, you're somehow injuring the skin in a controlled fashion. And as that skin heals from that injury, it builds more collagen. That's what makes things like microneedling, ablative and non-ablative laser resurfacing really powerful to stimulate your body's own collagen. And I find that it's a great alternative for people who may not want to use fillers. It's got a relatively short recovery with it. And you're not putting something foreign into the body, which despite the track record of the medications or the products, still bothers a lot of people.
When you're having a stroke, every second counts. Know the signs. Call 911. 2 WakeMed primary stroke centers and 7 emergency departments are here for you 24/7. With rapid assessment, neurointerventional expertise, certified stroke rehab, a comprehensive approach that can actually reverse some, if not all, of the effects of a stroke. WakeMed, when seconds count.
Hey, I'm Dr. Sarah Koenig. I'm the founder, CEO, and medical director of Triangle Wellness and Recovery in Cary, North Carolina. I work with an amazing team of therapists and medical and psych providers, and we work with people like you who may be struggling with mental health conditions or substance use disorders. We would love to meet you. Go ahead and give us a call, or you can text us or check us out on our website.
Looking for a fun, easy night out in the Raleigh area? Bring the whole family to an NC Courage match. It's more than just soccer. It's a full night of entertainment with fan experiences, theme nights, and something for everyone to enjoy. Feel the energy, connect with your community, and make lasting memories together. All at an affordable price with no ticket fees. Whether you're bringing friends, family, or a team outing, it's the perfect way to spend your night. Visit nccourage.com for more details.
Welcome to Podcast Cary, professional podcast studios with more than 50 shows making podcasting simple and fun. It starts right on our website. Pick a time that fits your schedule, tell us what you're working on, and we'll take care of the rest. You focus on the conversation, we handle everything else. Because starting a podcast should be fun, not complicated. Come see how easy it can be at podcastcary.com.
At risk of sounding like I am coming to you and using this episode as a
this is very much a free consultation.
Exactly. I'm not paying my copay today, doctor. But one thing that I have noticed about myself, and I think that this is common in women my age and men my age, It's the puffy eyes.
Yeah.
I sleep well. I feel like I drink plenty of water. What do you do about things that are essentially the opposite of wrinkles? It's the puffiness.
You could, I don't know if you'd have many listeners, but you could probably have an entire podcast dedicated to puffy eyes because it's such a complex process that is still not fully understood. So some of it has to do with the lymphatic and the blood vessel drainage of the area. Some of it is that, again, as the bone and fat pad structure changes underneath, we start to have more of a groove between our cheek and our eyelid, which then allows fluid lymphatic drainage to start to bag in those areas. Some people really swear by simple things like a lymphatic massage, which means you're using a smooth stone or your fingers to massage the area.
Gua sha stone or something? Yes, okay.
Some people need more than that, and sort of the ultimate thing is probably having a lower eyelid lift. That's not what most people need. And here, as in the rest of the sort of cosmetic world, I think education is such a big part of it. As an industry or as a profession, we should always strive to underpromise and overdeliver, right? I would be cautious of anyone, be it a product, be it a provider who can promise a simple fix for something that clearly isn't simple. And so things just aren't fixed overnight. Topical retinoid creams play a really big role in just how our overall skin complexion behaves as we age. They also build some collagen, and if you want, we can talk more about how that works. But I think between that and a lymphatic massage, that's what most patients or individuals probably get the most bang for their buck.
And going back to my teenage daughter, I've got a 16-year-old daughter who really for, I want to say years now, has been doing a whole skincare routine with a little bit of everything. And I'm like, gosh, I have never spent this much time or money. Perhaps she'll be my age one day and look like she's still in her 20s. I don't know. We'll see. But do you see that some of these products that are geared towards younger girls might actually cause harm?
Yeah, I'll tell you first that as, again, the dad of a 3 and a 5-year-old daughter, I'm terrified of what will happen in 10 years.
Yeah, you should be.
But as a dermatologist, I think for the most part, the products available in the U.S. and purchased on the U.S. market are safe. Now,
because they have to go through so many regulations.
Because they have to go through testing and regulation. Yeah. That being said, there are people who are getting products that are not available in the U.S.
Everything she has is straight from Target, so I think we're good.
And the biggest problem is not any one ingredient. I think the biggest problem we start to see is having these really long routines, and then if you start to become irritated to one of the products, it's very difficult to know what is my skin actually reacting to.
Oh yeah, which one is causing it?
Despite what my advice would be, the reaction is many times, well, let's add one more thing. Like this has vitamin C in it. It's supposed to be calming to the skin. So now we're putting a vitamin C serum on top of something because of the irritation. And ultimately, when we have patients who are oftentimes very distraught by this, then come into our office, first thing we say is stop everything. Use no makeup. Use nothing but a gentle cleanser for the 2 weeks. And let's just give your skin a reset. So that to me is the biggest challenge with the multi-step routine, is that they don't have a whole lot of evidence to say they're better than a simple routine. They're driven by a social media and marketing
and consumerism
machine. And they just run the risk of really doing too much to the skin, even though the individual steps are probably completely safe on their own, as long as you stick to what's mainstream.
Let's get into the topic that, again, we could have an entire episode on skin cancer, but I want to know how often a normal, quote, normal patient should go to the dermatologist each year, and when should we call and come in an extra time if we, what do we see that is going to constitute another visit?
Unlike mammograms and colonoscopy, dermatology doesn't have the defined criteria for annual screening, which makes it a much more nuanced conversation then. And so I think living in North Carolina, we're blessed to see a lot of the sun. And so probably should have a lower threshold to see our dermatologist than in other areas. The big things that drive our risk for skin cancer are having a family history of skin cancer, having a lot of moles on your body is a risk factor for melanoma type of skin cancer, being fair skin, light-eyed, freckles, red hair. That's sort of what we call phenotype or skin type is in and of itself a risk factor for the development of skin cancer. Having a history of artificial indoor tanning, so going to the tanning salon, is a very strong risk
Which
factor.
I've been hearing that has been picking up more recently. Whereas like back when I was a teenager, that was really big. We went to the tanning bed and it was a normal thing, but it kind of died off. And now I've been hearing that's back to being more norm now. Yeah.
And part of it is ever-changing legislation on who's allowed to go tanning with or without permission. And part of it is, again, social media. To me, the most powerful statistic is that one episode of indoor tanning increases your melanoma risk by 79%.
Ooh.
And usually that sort of conveys the risk. And so much of the risk of who needs to be screened when is cumulative, right? So a very fair-skinned individual who grew up working on a farm, who has a lot of moles and a strong family history, should probably be screened earlier than somebody with more Mediterranean skin, who maybe has an indoor job working on computers and no family history. And then ultimately, I think the biggest thing is to start to do self-exams at home. Again, we don't have good data on, do you start that when you're 35, 40, 45?
It's really just pay attention to your body, right?
Pay attention to your skin. And, you know, classically for melanoma, we think about the ABCDE, which means if you've got a lesion you thought was a mole or it's brown, but now it's asymmetric, it's got irregular borders, multiple colors or multiple shades of brown, the diameter is larger than a pencil eraser. And probably most importantly is the E, which is the evolution or it's a changing lesion. Those we need to see because that's behavior that's at least suspicious for melanoma. And that's the one we always worry about from a population health standpoint. We see way more basal cell and squamous cell cancers. Those are lesions that we usually see on the face, head and neck of individuals 50 and older. And those are more of your non-healing sores, the kind of red spot that either you're waking up with a little bit of blood on your pillowcase, or when you dry off after the shower, you've got some blood on your towel. Those are the basal cells and squamous cells, and there's just a national epidemic of those.
My husband has had a couple of those removed on his face, one on his scalp, and you're right. It kind of started out by looking like a scab or a wound that just didn't heal. Very small.
Yeah.
Not something that even drew our attention at first, but it just doesn't go away.
Exactly. And any wound that hasn't healed within 2 to 3 weeks, especially on the face where the healing is usually so rapid, should probably be evaluated. And for me, that was one of the passions of, starting my own practice is that if you look on a national level, the average wait time for a dermatology visit is somewhere between 2 and 3 or 4 months.
Yeah, you're right.
And we've just very much made it our mission to be able to have appointments available because if it's 4 months out, your terrible poison ivy rash is long gone and you don't need our help anymore. So thanks a lot for that. The melanoma should have been diagnosed 3 months earlier. And so I think
which could make a big
difference.
Makes
a huge difference. And we've published that. And I think it's just critically important to be able to provide same day or same week access.
So you as a practice, if I were to call as a new patient, there's a chance I can get in before next year.
Right. Now you've got me on camera.
I'm putting you on the spot.
It's in our sort of core mission statement is to improve the access situation for dermatology in North Carolina. And because of that, we always have appointment slots reserved for the next day.
I think that
it's
is
a peace
remarkable.
of mind service for patients.
Yeah, definitely.
And we found for the most part, it's very much honored, and we're seeing the right kind of individuals for it.
Good. I really respect that you guys are trying that. And I know it's not always possible, but you know, when you have something that you're worried about, you don't want to have to wait.
Because the
6
biggest
months.
thing is we start to fight what you learned on Google or what your uncle told you who's not a dermatologist. And so then it's just compounded worry, which is not fair.
Yeah, and not helpful to anyone. Okay, so I like to end episodes with a What's Up Roundup, but today we're going to do a special sunscreen edition of What's Up Roundup.
Okay.
Everyone talks about it, but I want to know if we're actually using it correctly, and we were probably not. Okay, what SPF should people really be using on a day-to-day basis?
Okay, Roundup is fast. The answer is 30. After 30 you get diminishing return.
So, do I put this SPF on after my lotion?
Your SPF should be the last thing you apply to your skin.
Okay.
Many people will do well with a combined moisturizer with an SPF sunscreen.
And that's fine, as long as it's
totally
that 30.
fine.
Okay.
Yes, that's exactly right.
So you say maximum of 30. These, 70 plus sunscreens, are they pointless, or should I go higher if I'm, say, spending the day on the boat or at the beach?
Yeah, great question. They're not pointless, but SPF 30 already blocks about 95% of ultraviolet B light. And so it's a diminishing return as you go to 50 and 70. Maybe you block now 98 or 99%, but it comes at the cost of a much more expensive and a much more pasty and thick sunscreen. So from a true safety standpoint, the application and the reapplication is where patients run into trouble. Everyone's good about putting on sunscreen before they go golfing. Reapplying after the first 9 holes is what we usually forget to do.
So how often are we supposed to reapply? And does it matter if water and sweat is involved?
Yeah, it matters very much. So most people should probably reapply every 2 hours, or if you're really sweating or in water. It's important to know that while there's some water-resistant labels to sunscreen, there's no waterproof sunscreen, right? It's a topical you put on your body, and there's water. It's gonna wipe off or wash off eventually.
So no matter what, if you're in the water or sweating a lot, yeah. Okay. Let's talk about, I love spray sunscreens, especially with kids. It's just so much easier. But are they as effective as lotions?
Ounce for ounce, they're as effective. The challenge is that when we use spray sunscreens, and I love them for my kids too, we end up not using enough.
Okay.
And so they're best not applied directly to the person, but sprayed into a hand and then applied to the skin, especially
Which
if
is
you're
really
doing
defeating the purpose of the spray.
100%. But in order to be able to quantify how much you're using, that's probably better. The other thing I want to mention is that kids especially should probably mostly use physical sunscreens. Those are sunscreens that contain zinc oxide or titanium dioxide as a barrier rather than the chemical sunscreens. And most sprays, with rare exceptions, are still chemical sunscreens, which are really not recommended for young children.
Why would they be not recommended for young children, but fine for adults? Do they have more porous skin?
Yeah, so the surface area ratio for smaller people or children is just less favorable. So you get proportionally more absorption relative to your overall body height and weight. And then there's concerns about the chemical structure of non-physical sunscreens, in the sense that are they maybe mimicking internal estrogen molecules and things like that, which obviously plays a bigger role when you're a 4 or 6 year old child.
So you're getting into one of my other questions, which is, I mean, I don't really want to call it conspiracy theory because that has a negative connotation, but there are more and more people that are believing that sunscreen is causing cancer or has more negative effects than good. What do you say to someone that comes in and says, "Oh, sunscreen is what caused my skin cancer"?
Right. The first part is really simple. We know that the absence of sunscreen for sure causes skin cancer if you're not protected. If you go back to indoor tanning as an example, the linkage between indoor tanning and skin cancer development is stronger than the linkage between tobacco smoking and lung cancer. So there's no question, right, that the sun causes skin cancer. If you're concerned, I think it's totally reasonable to use sun protective clothing. I love sun protective clothing. I think it's much easier to remember than reapplying. So I'm always in a hat and long sleeves. Mm-hmm. At the same time, I think, unfortunately, conspiracy theory is to some degree the right word. There's really no scientific studies that sunscreens are harmful. Mm-hmm. If someone is concerned, then I think using physical blockers, which again are those sunscreens that are mainly targeted at children or babies, are less worrisome than chemical sunscreens. And so at least that's been my approach, and I found that to work well.
Yeah, I think that makes a lot of sense. And I mean, the zinc sunscreens are the ones that you like, they just leave your whole face as white as your shirt.
Yeah, and the industry has gotten a lot better about that. Okay. And so that's really one of the main areas where the sunscreens have improved. And it's the other thing I'll answer to patients when they ask me, hey, what sunscreen should I use? I think it's not about what brand you're using, but it's about finding an SPF around 30 with a texture that you like. And if you are very dry skin, maybe it's a greasier sunscreen. If you're very greasy at baseline, it's probably a very light sunscreen. But anybody watching this on video, like I have sunscreen on right now. It's a zinc sunscreen. I'm not particularly white, I hope.
No.
And so
I would not have
it's
guessed.
really about finding the right product.
Okay. And finally, let's say you forgot the sunscreen and you got burnt.
Yeah.
What do I do now?
Yeah.
Is aloe, the good old aloe, the best route to take?
Aloe really does help. Mm-hmm. Sometimes cool rags with just lukewarm water, especially if you have a larger surface area that got sunburnt, it really does become a true burn in terms of how uncomfortable you are as a person. And so aloe, cool wraps. But the biggest thing is you have to stay out of the sun afterwards. Mm. It's really easy to be burnt a second time. And there is no such thing as a protective base tan. We didn't get a chance to talk about that today. But you can't really avoid the sunburn with prior sunburns or prior tanning.
Well, it's interesting that you say that because you do hear the term base tan. You know, we're getting into summer months now, heading into Memorial Day weekend when a lot of people head to the beach. And I have probably even said myself, well, let me get a good base tan to set myself up for the summer. But you're saying that that's not really a thing. I mean, I would say I can kind of see where it makes sense because, you know, you're building upon something and not starting out, you know, with my winter whites.
Yeah. The challenge is that the body's skin cells only release pigment in response to DNA damage, which means anytime you're increasing your tanniness, your skin color brownness, you're doing so in response to DNA damage. And so that's why you really can't have a base tan, because even that base tan has triggered DNA mutations to get you there. And DNA mutations are the first step in the development of cancer or skin cancer.
Okay, so bottom line is we need our sunscreen and we need to reapply regularly.
I'm afraid so.
Okay. Thank you so much for being here today. Thank you for coming on and getting us ready for the summer months in the sun.
It was a pleasure. Thank you.
Thank you.
Thanks for listening to What's Up Wake with Melissa Wistahuff, presented by the publishers of Carrie Magazine, Wake Living, and Main and Broad. Follow them on social media at Carrie Magazine NC, at MB Magazine NC, and at Wake Living Magazine. Visit each magazine's website at carriemagazine.com, mainandbroadmag.com, and wakeliving.com to check out the latest digital edition of each magazine and find pickup locations. Be sure to subscribe and leave a 5-star review to help others find us. Music provided by Angie Bagley and Chris Bagley. This show is produced by Podcast Carry.